Okay, well, great. Hello, everyone. Thank you so much for joining this webinar today. My name is Lisa Iguchi. I'm with the Oregon Health Authority, and this webinar will cover the COVID-19 vaccination reporting updates for our long-term care facilities. As I mentioned, this webinar will be recorded, and we will post a recording of the webinar as well as the webinar slides on our website, and I will share this out with my communications to facilities as well. So some of the objectives that I have, as we'll cover today, is I want to first talk about the upcoming changes to our OHA reporting. Oh, Susan asked if I can speak up. Susan, am I still quiet for you or am I quiet for others? I will try to speak up a bit more. My apologies. Okay, so I will discuss the upcoming changes to OHA reporting. I will highlight the current COVID-19 vaccine recommendations and the up-to-date classification. And I will review updated resources, including the OHA tracking tools. So in terms of our COVID-19 vaccination reporting, there are several updates that I want to review. So as a reminder, reporting to OHA is required per our Oregon administrative rule. We have this requirement for all of our licensed long-term care facilities, including our assisted living and residential care facilities, or what we call our community-based care facilities, and our nursing facilities. The change that we are making starting in July is that the frequency of reporting for our assisted living and residential care facilities will change to a monthly cadence rather than weekly. So what we're asking you to do is just report once a month starting in July, with the time frame being that we'll ask you to report for the first week of the month, and we'll keep that survey open for the rest of the month. And I will go through this timeline in further detail in my upcoming slides. I will note, though, that if you are someone who is reporting for a nursing facility, there is federal requirements that are still in place through CMS that require you to report through a weekly cadence. And so the change, again, is specifically for our community-based care facilities. Nursing facilities will still need to continue to report on a weekly basis. And I would refer, if you are from a nursing facility, to look at the NHSN training materials for further guidance on your reporting. In terms of why we continue to ask you for COVID-19 vaccination data, although COVID-19 individual case reporting is no longer required to be reported to public health, we do ask reporting of outbreaks to still be done to public health, and we investigate those and respond to those. We are continuing to see COVID-19 outbreaks in our congregate care settings, and vaccination is a key intervention to prevent residents and staff from morbidity and mortality from COVID-19 infection. Also, although that healthcare worker vaccination rule is no longer in place for Oregon healthcare facilities, there continues to be a strong recommendation that residents and staff be up to date with COVID-19 vaccines. And we want to understand how facilities are doing with their vaccine uptake. Based on the data that we have seen so far, there are low rates of individuals who are classified as up to date. We've seen about 28% of staff shown as up to date and 51% of residents, which is a much lower percentage than the 80+% we saw with those who completed the primary series. Additionally, what I'll review in the next few slides is that there are changes that will be coming to who is considered up to date. And we anticipate changes to vaccine recommendations as different vaccines are developed to look at different strains. And so we want to be able to continue to understand how facilities are doing with the changes to the up-to-date definition and vaccine recommendations. And this continues to be a valuable metric for us to be able to assess. I will also note that this reporting is not unique to our long-term care settings. This reporting aligns with federal requirements that are in place for nursing facilities, hospitals, ambulatory surgery centers, and inpatient psychiatric facilities. And so we want to be able to understand how our healthcare and congregate care settings are doing overall in our state on COVID-19 vaccination uptake. In terms of vaccine recommendations and up-to-date definition, I want to review what is currently recommended for the COVID-19 vaccines. So currently, everyone 6 years and older should receive 1 dose of updated bivalent Pfizer or Moderna vaccine, and this is regardless of receiving any original COVID-19 vaccines. Previously, in order for someone to get the updated bivalent Pfizer or Moderna vaccines, they needed to initially complete the primary series, but this is no longer the recommendation. Additionally, there are some groups who can get a second dose of the bivalent vaccine. So individuals who are 65 years and older, and those who are moderately or severely immunocompromised are also eligible to receive a second dose of the bivalent vaccine. And starting in April of 2023, the original monovalent doses are no longer available. So anyone who's currently getting a Pfizer or Moderna dose is receiving the updated bivalent dose. And with this recommendation, the up-to-date classification has been simplified. So an individual is considered up-to-date now if they've received 1 dose of the updated Pfizer or Moderna vaccine, and this is regardless of if they received any original COVID-19 vaccines. So as long as they get 1 updated Pfizer or Moderna shot, they are considered up-to-date. And so this has impacted how, the questions that we are going to ask you going forward for our COVID-19 vaccination reporting. So what we've really done is try to simplify as much as possible the questions that we're asking. So for staff, we are not asking any questions about the primary series that has been removed. We'll continue to ask you about up-to-date counts and want to ensure that this is now going to be counts that reflect the updated definition. So those who've received 1 updated bivalent dose rather than those who've completed the primary series and also received a bivalent dose. So there might be additional staff in your facility who now meet the up-to-date definition. And similarly for residents, we won't be asking about primary series or boosters or additional doses, and just focusing on those up-to-date counts with the updated definition as well. So here's a summary of what questions will be included on the reporting survey. There will be 3 required questions each for staff and residents, with no new questions added. So we'll ask you, as before, the total number of staff or residents in your facility. We'll ask you the number of staff and residents who are up to date with the COVID-19 vaccine, and then anyone who has a medical contraindication. The questions about offered but declined the COVID-19 vaccine and has unknown status remain, but they continue to be optional for you to report. And as I mentioned, we are changing to a monthly cadence for our community-based care or CBC facilities. And with this, starting in July, we're asking for data for the first week, which will always be the first Monday of a given month through the Sunday, to be collected. Once that week ends, the survey for that month will open, and the survey will be open until the last day of the month. And this week reporting is something that I think you are familiar with as previously, since you've reported on a weekly basis. But we want to continue doing this week reporting period to align with our nursing facilities who continue to report weekly so that we can standardize the information across all of our long-term care settings. So to visualize this, how this will look starting in July is that the first week of July is July 3rd through the 9th. During that time frame, you don't have to report into the survey for that week, but you should be collecting your data. The survey will open in July on Monday, July 10th, and it will remain open until the last day of the month, which is July 31st. So any of those days here that are highlighted in blue, you can log in and just complete the survey one time. Then for August, the first Monday of August is August 7th, so that's the first week of the month. During that week, vaccination data for 8/7 to 8/13 should be collected, and then the survey will open on August 14th and will be open until the 31st. So again, any weeks, any days that are highlighted here in blue, you can go in and just do that one-time report for the month. How this will look when you log into the OHA survey. So when you log in and you go into the landing page, if you log in during that first week of the month, you will see a message that says a survey is not available because it's too early to submit. So we'll ask you to log in during those days that it is open, and you'll get one button to enter in your data as we have before. And this layout should look familiar to you, but it has simplified. So questions 1 remains the same. The question 2, instead of asking about primary series, is now asking about up to date. So that question just has moved from the bottom of the page up to question 2. And then, question 3 should look the same to you as well. And the questions that are outlined in red here are the only ones that we're asking you to complete in terms of what's required. The other questions are optional for submission. And then similar for residents, it's just again that question 2 has moved up in terms of the question about up to date, has moved up from the bottom to this middle part here. But the other questions, question 1 and question 3, are the same. And then again, just those 3 fields that are outlined in red are required to be reported. Similar to before, as long as you have submitted for the prior reporting period, you will have an option to pre-fill your data from the prior week. And so you can take advantage of this pre-fill button. We just ask that if you do utilize this pre-fill button, that you just double check your counts and make sure to make any edits for any counts that have changed. As a reminder, please report how many individuals have so far received the updated COVID-19 vaccines, not just the number of vaccines administered during that particular reporting week. We want to have an understanding of who in your facility is so far received the updated COVID-19 vaccines. If any fields in red, so the total number of staff or residents, the number who are up to date, or the number with medical contraindication are not applicable, say you don't have any residents in your facility who have a medical contraindication, please just enter in 0. Do not leave it blank. You will get an error message that indicates that it's missing. And then the counts in questions 2, so counts of up to date, and counts in question 3, so if they had a medical contraindication or declined or had unknown status, that should not exceed the total that you report in question 1. So for example, if you're reporting you have 100 total residents in your facility, it doesn't make sense to say I have 150 who are up to date. This will indicate potentially a data entry error. And so you will get an error message to indicate that the count needs to be, you'll just want to review that information. So the last thing I want to review is our updated OHA resources. and specifically our tracking tools. So we have developed tracking tools I think some of you are familiar with and have been using. So we have a staff tracking tool and a resident tracking tool. As a reminder, these tracking tools are optional, but they will help you with your own internal documentation and will also auto-calculate the summary counts for reporting. Since now we are really simplifying the questions that we're asking you to report and collect data for, I have developed a more simplified tracking sheet, which I recommend using. This will track only the information needed for reporting. However, I know that there might be some facilities who want to continue to maintain information about all prior vaccinations that have been received by staff or residents. And so I have developed an optional detailed tracking tool that will retain all vaccination documentations for historical purposes. And I'll review both options in my next few slides. So what I've done with our tracking tools is I've really simplified it to just collect the information that is needed. So here you can see this is the tracking tool for our staff. There is now one column that is outlined in red to document receipt of the updated bivalent dose. And here you just have to enter in the date that someone received the updated bivalent dose. You do not have to also enter in a manufacturer since that is not information that we are collecting. The other fields here, if you have been using our tracking tools previously, should all be the same, should look familiar to you. So if you are someone who wants to transfer your data over from a prior tracking tool, you can go in here and copy and paste the data from these columns and paste them into this new tracking tool as values. If you're someone who is using these tools for the first time, I've really tried to minimize the information that is being asked here, just to make sure that it just fulfills the information that we are asking for, as well as information that NHSN is asking for if you are someone who reports into NHSN. And similarly, this is the resident form, the tracking sheet. Again, just one column here to document receipt of updated bivalent dose, where you just have to enter in the date. And then the other columns here, if you are using our tracking tools, you can transfer the data over. And otherwise, these are the columns that are really just the ones that are needed in order to complete the fields or the questions that we are asking for going forward. Now, on the other hand, if you are someone who wants to continue to retain the information that you have on our current tracking tools, which collects a lot of information about primary series, additional or booster doses, then I have developed an alternative, what I'm calling the detailed COVID-19 vaccination tracking tool. Here I've added in new columns because there could be some instances where individuals have already received 5 monovalent doses and have gotten 2 doses of the updated bivalent vaccine. And so I had to add in additional columns here. This will track updated bivalent doses in addition to prior vaccinations, but it is quite a large tracking tool. So what I've done is I've hidden tracking of optional columns just to kind of make it a bit more straightforward in what we want to collect going forward. These columns are currently hidden, but you can always go ahead and unhide them if you want to see everything. And what I'll say too is that if you have any questions or need help with transferring your data over with these tracking tools, you can always reach out to me and I'm happy to assist. Similar to the steps, kind of the process to transfer over your data from prior versions of our tracking tools, I've outlined steps here on how to copy and paste your data over into these detailed tracking tools. But regardless of which version you choose to use, the weekly summary sheet will look the same. So this is the weekly summary sheet I'm showing for staff. Again, for the first week will be the first week of July, so 7/3 to 7/9. And here you can see we have fields with the red numbers highlighted that indicate these are the required questions that we have for the OHA reporting survey. What I'll note here is for the staff sheet, I have kept in the counts for who've completed the primary series. This is not something that we at OHA are asking for reporting for, but this is something that nursing facilities are still being asked to report into NHSN for. And so I've kept that here for those nursing facilities who are using our tracking tools. But otherwise, the counts here for questions 1, 2, and 3 should reflect the counts that you need to report in our reporting survey. And then similarly for the resident tool, either option you choose on the weekly summary page, it will calculate the counts that are required for us to be reported to the OHA reporting survey, and the layout will look exactly the same. So just to kind of summarize the tracking tools again, these are optional tools that you can use to help with reporting. It's not required for you to use, nor do we ask you to submit them to us. As I mentioned, I have simplified the tools to document receipt of updated bivalent doses going forward. Really, you should not need to necessarily document receipt of primary series or additional boosters in order to make the up-to-date definition going forward. We just need to know if someone has received the updated bivalent dose. Again, there are detailed tools if there is a need or interest to retain prior vaccination data, maybe if that is something that is required for internal or agency use. And what I recommend is if you are transferring in any data from the prior versions, just to filter and include only those residents and staff who are currently in your facility. It can be a lot if you're trying to copy over every single person that you've entered on the tracking tools. And so I recommend just copying those who are currently in your facility, as that is really the ones that determines the counts that are required for reporting. Just some tips if inserting or deleting rows can cause calculation errors. And if you are seeing counts that don't look as expected, always double check that the dates that have been entered are correct, as that can really influence the calculations. Again, I am available if you need any assistance with the tracking tools. I'm always happy to assist and help to troubleshoot any issues. So just to summarize the upcoming changes before we get into questions, again, starting in July, the reporting will change to once a month. So we'll just ask you to report, to go into that the survey one time a month and submit those counts. I will continue to send out email reminders about this to make clear when the reporting survey is open and when, until when you have to submit the survey to us each month. Anyone who's received an updated bivalent vaccine is considered up to date. So please start to review who has received an updated bivalent vaccine, as that will influence the counts that you report for up to date. We've simplified the survey so that there are now 3 required questions each for staff and residents, which is less than what we are currently asking for. And the pre-fill option will still be available. So we hope that with the simplified questions, the pre-fill option, and the once-a-month report, it will decrease the reporting burden for you. And again, we have tracking tools that are available but are optional if you'd like to use them, and those will auto-calculate the counts that we're asking for. We continue to post the resources on our OHA COVID-19 healthcare providers page. This is where I will post the recording and the slides. But again, as I mentioned, I will also share that with all of you in my communications to facilities. And that is all I have. So now we have a lot of time for questions. I'm not sure if we need to take the full hour, but I do see some questions in the chat, so I'll start with that. And then please continue to input in your questions. So Casey asks, is there a possibility that we will be done with this reporting altogether in the semi-near future? Casey, I'm not able to answer that question. I will say that we generally have aligned with the nursing facilities who have federal reporting requirements to report. And we kind of tend to look at, what are requirements for them. And I haven't heard yet that there is like a hard end date for that. We continue to evaluate and work with the Oregon Department of Health and Human Services, which the rule is under their agency to determine, continued need for this reporting. And if there is any changes around the reporting, we will communicate that out to our facilities. Judy asked, so does updated vaccine status equal a vaccine of the vaccination that has only been available since April 2023? That's a great question. So to determine updated vaccines, if someone had completed a primary series and was getting a booster dose of Pfizer, Moderna, that updated vaccine became available September of 2022. And so typically if someone got a booster dose after or during September or after, they would have received the updated bivalent dose. And then April 2023 is when individuals who hadn't received any vaccines previously, if they did go ahead and get a vaccine that was Pfizer and Moderna, the only vaccines that would have been available is the updated bivalent dose. Terry asked, so I will put in the chat the tracking tool links for all of you to see, although they are the existing links on the website, but I will put that in the chat for you guys as well. Let me do that right now before I forget. So I'm putting in the tracking tool links, and then I'm also putting in the detailed tracking tool links, so you can look at either option and choose which one you want to use going forward. Dawn asks, our surveyors have been asking for proof of submission. Will you be providing a way for us to either print it off or get a received notification? On the landing page of the survey, when you log in, there's a table that shows the submission week reporting history. And that is really typically what I've heard the surveyors have been asking to see is that table. If you want a print off or need assistance with trying to locate that, you can always reach out to me and I'm happy to assist. But typically that's what we've heard is if you can show them when you log in the submission reporting week and they can see what weeks you've been submitting, that is what they need to see. So there is a question, where can we find new information of the new rules? There is a guidance document that we have, which I will include, I will put in the chat as well, that talks about the changes to the rules. But this webinar really was intended to be kind of the first place where we describe the upcoming changes with more specifics on the monthly cadence. Tracy asks, does OHA match DSS requirements for assisted living requirements for vaccinations? Tracy, I'm not sure if I fully understand your question. I would say that we work closely with DHS and would support if they had any recommendations or requirements for vaccinations. But I'm not quite sure I'm fully understanding or knowledgeable about what the DHS requirements are for vaccinations, because this specifically is just about the reporting itself rather than the vaccination requirements. Manny asks, when you say staff, are these limited only to caregivers, nurses and doctors, or everyone, including kitchen staff, HR, etc.? So Manny, this is really everyone in the facility who is scheduled or is working in your facility for at least one day during the reporting week. And we have a guidance document that is on our provider page that defines exactly what staff kind of encompass as well. So there's a couple questions about the updated bivalent vaccine. So the bivalent vaccine is really the standard since April 2023. That is when the original monovalent vaccines were discontinued, but they became available in September of 2022 as a booster shot. So anyone who received a booster shot from September 2022 onward, if it was a Pfizer or Moderna shot, then that was the bivalent dose. So Jennifer says our surveyors just want to see the table, not a printout. So I think that was related to the other question I had. There was earlier. So just it sounds like other facilities are saying as long as you log in and show that table, then that will suffice. Monica is asking, so just to be clear, anyone that got the vaccine in September of 2022 is considered vaccinated. And I think I want to clarify that they would be considered up to date. And we want to be sure that when we're talking about vaccine, specifically the Pfizer and Moderna vaccines are the ones that are the updated bivalent dose, because there is a Novavax dose that was made available. And the bivalent dose was available, as I mentioned, as a booster in September of 2022. And then it became the standard in April of 2023. Marley asked, just to clarify, the detailed tracking sheets have the necessary information for NHSN reporting by nursing facilities. Yes, Marley, that is correct. Either the detailed or the kind of more simple tracking sheet will have the necessary information that nursing facilities need to report to NHSN. There's a question, is there a place to retrieve COVID cards from residents or staff who lost their card? That is not something I am familiar with, but I can ask my immunization program colleagues if they have any suggestions or options, and I can follow up with you on that. Carrie, I did include the both the resident and the staff tracking sheets in when I sent those links. So if you're not able to find them, I can resend them again. And then Janita asked, so starting in July, we're no longer reporting once per week, but once per month, correct? Yes, that is correct. So starting in July, basically on Monday, July 10th, the survey for July will open, and we'll just ask you to report that once a month reporting. And then each month after that, you'll just have to go in once a month to submit the data. Okay, thanks, Carrie, for clarifying that you see them now. And I will send out these resources as well to the group in my typical email reminders that I sent out to our facilities. I'll give it another minute or so for questions. And then I'm also gonna just show my last slide with my contact information for those of you. Oh, I'm sorry, my contact information is incorrect. Let me correct that right now.
Did you want me to unmute the mic?
Oh, was someone trying to ask a question?
No.
Okay. Sorry, I'm just trying to put in my correct email address for all of you. And I'll also type this into the chat if anyone has questions. You can always reach out to me via email. And I will get back to you as soon as I'm able to. I'm not seeing any additional questions coming through. So I will say that if you do have any questions as you're reviewing the materials or the tracking tools, please don't hesitate to reach out to me, and we will plan to get this recording and try and post it with the slides as soon as possible. I will communicate by Monday when I send out my reminder emails to facilities, the additional resources with the tracking tools, as I mentioned. And then starting in July, you'll see these changes to the reporting survey when you log in. So with that, I think we can end early and give everyone 20 minutes of time. Thank you all so much for taking the time today to join me. Really appreciate it. And again, if questions come up that you think of, please don't hesitate to reach out. Thanks so much.